One of the things that you mentioned, in our community, we operate by a lot of myths and untruths. Okay? You've heard me talk about them on the radio. Okay? One of the myths that occurs in our culture among African American people is that high blood pressure medicines will make you impotent. In other words, it will affect you in such a way that you will not be able to get an erection. Now, getting an erection, how important is getting an erection to you? Raise your hand if it is. I see a brother back there got both hands up. Okay, all right, very good. And that's normal. That's normal. However, taking blood pressure medicines does not keep you from getting an erection. In fact, if you have high blood pressure and you don't treat it, you will not be able to get an erection because you're going to have a stroke or a heart attack. Okay? Now, can the medications affect your ability to get an erection? Absolutely. But there are medications that you can take that won't, as one of my patients say, this medicine is bothering my nature. All right? One of my patients came in and told me, we were sitting down talking, and I thought I had him all squared away, and as I was getting ready to walk out the door, he said, Doc, he said, you know, Leroy ain't working right. So I came on back in and sat down because I knew that was very, very important to him. So anyway, we talked about the medications that he was taking, and we talked about all of the kinds of things that will affect Leroy. Well, I reminded him that, you know, he continued to smoke. Smoking will affect Leroy. He was drinking more than he should. That was affecting Leroy. And I reminded him of this big belly that he had. That was affecting Leroy. All of those things were affecting Leroy. So one of the things we want to point out to you is that your ability to have an erection is really an indication of what kind of health you're in. If you can have good erections as you get older, that's good. That's good. But if you're a young man, I remember seeing a young man to come in my office. He was like 26 years old. He had just gotten married. And after a month, he came in and said he was having a difficult time getting an erection. He had just gotten married. Okay? So I asked him a bunch of questions, and he told me that he smoked 2 packs of cigarettes a day. Okay? If you smoke 2 packs of cigarettes a day, Leroy and Johnson is not going to work right. Okay? So I just had to remind him of that. I'm sorry, Mr. Johnson. But anyway, the reason I said that because one of my patients came in, he didn't give me Leroy, he said, my Johnson is not working right. Okay? So, but the bottom line is that if you have high blood pressure, you have to take the blood pressure medicines every day. Now, normal blood pressure is anything below 140/90, but that information is changing. And according to the new information, we really do need to have that blood pressure down around 120/80. So you're going to need to talk to your doctor about that. So if you are 140 or less than 140/90, but you're staying right around close to it, it may be required that you are going to need to have another medication to get you where you need to be. So if the doctor tells you that you need to have another medication to get you to go, don't frown upon that. Take the other medication, okay? But now I gotta tell you that we get involved in a lot of lifestyle stuff that causes our blood pressure. We take the blood pressure medicine, but we still use cocaine. We take the blood pressure medicine and we still smoke marijuana. We take the blood pressure medicine, but at every meal, we put a lot of salt on our food. Okay? So if you we take the blood pressure medicine and we drink a half a case of beer on the weekend, starting on Thursday. All of those things affect your blood pressure too. So the bottom line is you develop a healthy lifestyle. You don't smoke. You cut back on the amount of alcohol that you're using. You exercise on a regular basis. You keep your weight under control. And you decrease your stress level as much as you can. And you take your blood pressure medicines every day. You'll do just fine. Okay? Now, I know I threw in a lot of information, so let me answer a few questions about high blood pressure because that's a major problem. I would venture to say that most of us in here have high blood pressure. In fact, one of my medical colleagues told me that he doesn't even ask black people whether or not they have a history of high blood pressure because most black people have a history of high blood pressure, and if they don't know about it, it's only because they didn't ask or their family member didn't tell them. But if you have high blood pressure and you have a question about that, I'll take any questions about high blood pressure right now.
I take my high blood pressure medicine in the morning.
Right.
Now, is that a good time to take it?
That's an excellent question. You should take your high blood pressure every morning. Now, this is what happens with a lot of African Americans. They think that you have to eat and take your high blood pressure medicines at the same time. You do not have to do that. Suppose you don't eat the whole day. That means that your blood pressure is going to go up and could cause something catastrophic. So most blood pressure medicines can be tolerated on an empty stomach. So as soon as you get up, you should take that blood pressure medicines because one of the things that you are not aware of is that your blood pressure goes up when you wake up in the morning. If you have high blood pressure, you don't want it to go up. That's why you want to drop that pill. Okay? So taking your blood pressure medicines with or without meals is very, very important. So don't get caught up in the myth that you got to take it with food. What are they thinking about? They're thinking about diabetes, all right? But blood pressure medicine should be taken every morning. And by the way, you can't take your blood pressure medicines on Monday, skip Tuesday, don't take it on Wednesday, and then take it on Thursday and expect it to be under control. The blood pressure medicine is designed only to work somewhere between 18 and 24 hours. So at the end of 18 and 24 hours, your blood pressure will begin to go back up if you don't take that blood pressure medicine like you're supposed to. So, I want you to be so concerned about your blood pressure medicine that if you are getting ready to make a trip somewhere and you forgot your blood pressure medicine and you are thinking, should I go back and get it? Unless you got another way of getting it from somewhere else, you need to turn around and go back and get that. That's how important your blood pressure medicine is. Now, heart disease continues to be the #1 cause of death in the United States, and definitely the #1 cause of death of African American men as well as women, having, as Fred Sanford say, having the big one. All right? So in order to decrease your risk for having a heart attack, you got to keep your blood pressure under control. I'm reminded of James Brown, who died a couple of years ago, and if you remember, they say he died from heart failure. Okay? After some investigation and kind of looking into that, he also had high blood pressure, but he was not compliant in taking the medications every day. So when your blood pressure goes up so high and it stays up high, it affects. Any plumbers in here? Anybody who's a plumber? No plumbers in here. If your blood pressure goes up very, very high and it stays up that high, it causes the heart to have to work harder. And with time, that heart muscle is going to go out. So therefore, you need to take that blood pressure medicine every day. Yes, sir.
The question I have on taking high blood medicine, the other thing that, well, I'm told by my physician is to take a low-dose aspirin. Does that help?
The low-dose aspirin, very good question. The low-dose aspirin is good because it helps protect you from having a heart attack, but it also helps protect you from having colon cancer. But yes, for some people it does work. It doesn't work for everybody. I think it works better in women than it does in men, some studies show. But there's nothing wrong with taking an aspirin every day. That's a good thing.
And I noticed you said aspirin, not particularly low doses.
It depends on what your doctor tells you to do. You can take the 365 milligram tablet or the 81 milligram tablet, yes. Okay? Any other questions about high blood pressure and heart disease?
Yeah, two questions. First of all, you mentioned there's a lot of myth in the black community about medication. I've heard and still hearing that one of the good things is to take some apple cider vinegar with your orange juice in the morning. That really helps. And also, I think it's a fact that you don't drink no grapefruit juice 30 minutes after you're taking any medication. Is that true or not?
Okay. Those are some myths and untruths. The thing with grapefruit juice is that if you can stay away from drinking grapefruit juice when you're taking your blood pressure medicines, do that, because there are some studies to show that grapefruit juice interferes with the absorption of the medicine. So I would recommend that if you don't take your blood pressure medicines with grapefruit juice. Just don't do that, okay? And the other question that you asked me,
Apple cider vinegar with...
apple cider vinegar, it may taste good, but it does not control your blood pressure, okay? It controls your blood pressure about as much as putting some moss in your shoes. Now we from Charleston, we're all from Charleston. Y'all have heard people putting moss in your shoe and say that's gonna keep your blood pressure down. No, that's one of those myths that we wanna get rid of. Okay? And you know, since we're talking about myths, one of my pet peeves is that you all listen to the radio and you hear these commercials talking about getting beta prostate and getting you some hormones. It's going to make your manhood better. Don't fall for that, okay? Now, I know that even when Al Sharpton talks about it, just because Al is a preacher, he's not a doctor, all right? And if you'll notice that same script is read by Tom Joyner and a bunch of other people in the African-American community trying to encourage you to do these things, all right? That's false information. Do not do that. Do not give those people your credit card. I had a patient come in, and he was on beta prostate. He bought it in, and to ask me whether it worked, and I told him no. And so he came back in the next month, and he said he couldn't get the people from continuing to hit his credit card every month. So he had to get rid of that credit card, because even though he called them and told them to stop it, they was hitting that credit card every month. Okay, so African Americans, you know, we are somewhat gullible when it comes to information. So have you not ever wondered, well, if this works so well, why didn't my doctor tell me that? Get your information from people who are trained to give you the information, okay? I liken it to, how many of you got a car that you really love? All right? Would you take your car that you really love to Joe Smoke over here, who has a sign on his thing saying he's a mechanic and he can fix everything? You wouldn't do that, would you? Why wouldn't you do that? Yeah. So you want to make sure that you get your information from your healthcare professional, from your physician. Don't go for that. All right, there was another question. Yes, sir.
Hey, Doc,
is a heart attack and acid reflux, do they have the same?
That's a very good question. He's asking about heart attacks and acid reflux. Heart attacks in men and heart attacks in women are different. The signs and symptoms are different. About a year ago, I gave, in addition to barbershop talks, I also do beauty shop talks. And by the way, I need to let you know that when I do these beauty shop talks, there's a section in there that women want to talk about the health of their man. I just want y'all to know that. All right? But with reference to heart attacks in men, typically the signs and symptoms of heart attack in men are fairly dramatic. Men usually get a crushing-like pain in the center of their chest. They will tell you it feels like somebody's standing on my chest. Oftentimes they will get what we refer to as referred pain, which will run down the arm. Sometimes they will get pain in the back. They will also experience an acute onset of nausea and vomiting. Okay? Those are the signs of a heart attack. Now, you should not take a Rolade and think that it's going to go away, especially if you have the risk factors for having a heart attack. The risk factors would be, number one, heart attacks running your family. I have a patient who's since passed away. Heart attacks ran his family. His father died of a heart attack. So knowing your family, this is where knowing your family history is very, very important. But in answer to your question, reflux esophagitis, which is heartburn, can often feel like a heart attack. And if you think that it very well may be reflux, you need to go to the emergency room and have it checked out to make sure that it is, okay? But if you have risk factors for heart disease, like uncontrolled blood pressure, uncontrolled diabetes, you lead a sedentary lifestyle, which means that you don't do nothing. You're a couch potato. You're overweight. You smoke. You drink a lot. Those are risk factors for having a heart attack, and you just kind of need to put all of that together. But if you're not sure, go to the emergency room and have it checked out. Now, a couple of months ago, I gave this talk to some ladies, and I was sitting there explaining the risk factors and the symptoms of a heart attack. So this lady who was sitting on the front row, she got up and she left. I later found out that she went to her best friend's house, and she went there to tell her that she was having a heart attack and she needed to go to the emergency room. The very symptoms that I had explained to her, she said that her best friend had told her those same symptoms that morning. And she was sitting home waiting to see whether or not she was going to get better. She had bypass surgery the next day. Okay? So we do have signs and symptoms. Now, you may have heard just a couple of days ago that we found out that people who have what they call sudden cardiac events, like all of a sudden somebody in here just pass out from a heart attack. We used to think that those people did not have any symptoms. But now we know that before they have the big one, the body usually gives you some warning signs. But whether you will adhere to the warning signs is something different. Okay? So we found out that, yes, experiencing an acute onset of fatigue, a chest pain that feels like heartburn but may go away, those are very, very serious symptoms, and you need to go to the emergency room to get it checked out. But the bottom line, in answer to your question, the signs of reflux and the signs of heart attack can be the same, but you got to think a little bit further. If you have those risk factors that we talked about, then it would be in your best interest to go to the emergency room and have it checked out. Here's something else that I want to tell you. You will get better treatment from your doctor. I don't care if he's black, white, or green. When you go to the doctor and you know something about what's going on with you, you will get better treatment. You will get better treatment if you can tell the doctor, I'm on 5 medications, I know the names of them, and I know why I'm taking them. When a patient comes in to see me and he can discuss with me in his terms what's going on with him, it gets my attention. It tells me that he is really, really interested and has paid attention to his health. So if you can, don't go to the doctor and she say, well, what medication are you taking? And you say, I'm taking a little blue pill, and I'm taking a little yellow pill. Well, what are you taking it for? I don't know. The doctor just gave me these. All right? So you really want to step up and you really want to learn the name of your medications and why you're taking them. It really does help the doctor, and you'll get better treatment from the doctor if you can articulate what we just talked about. Did I answer your question?
Yes, yes. And hold on. And
Okay, you got one more question.
I had a friend of mine said that he was having a lot of
Speaking to Mike. Can you picking up this okay? You speaking to the mic.
I had a friend that he was saying that he was having a lot of heartburn.
Yeah.
So I said, well, you sure you know the symptom between a heartburn and a heart attack? He said, no. I said, well, you need to go get it checked because
That's exactly right.
if you don't notice a heartburn, the symptom between a heartburn and a heart attack, you could be having a heart attack and you don't even know.
That's exactly right. About 2 years ago, an attorney called me and asked me would I look over a patient's chart to find out whether this doctor was doing the right thing regarding having picked up on a heart attack. And so I reviewed the information, and the doctor missed the diagnosis. And literally, as I was reviewing the chart, I got a call from another attorney saying, this patient's daughter wants to sue this doctor because according to the things that she's heard you talk about on the radio, he should have picked up on the fact that her father was having a heart attack. He treated him for reflux and sent him home. Well, as you know, when you're asked to be an expert witness, you can't be an expert witness for both sides. So I told him I couldn't discuss that case with him. He said, you already been called by the other side. I said, I can't discuss that with you. He said, well, I know I'm on the right path there. Thank you, Dr. Bell. So, yeah, okay. So it's important. And this is why we do Closing the Gap in Healthcare, all right? If you notice that I'm giving out a lot of information, and I hope that I'm giving it in a way that you can understand it. That's why I tell these little stories. I don't use big words. I really put it out there so you can understand it. So if I can improve your health literacy, then I very well may be able to save your life, because if you hear me talk about chest pain, and you say, wow, Dr. Bell said that very well may be a heart attack. I'm going to the emergency room. I cannot tell you the number of people who have heard me talk about things on the radio and gone somewhere and gotten it checked out, and it ended up being something bad. So that's why these kind of conversations, particularly with African-American men and women, is very, very important. Okay, we got a question right here. Yes, sir.
What are the symptoms of the heart attack? The symptom?
Chest pain that feels like something is standing in your chest. It could be a burning pain. The pain can usually radiate down your arm and cause your arm to feel like it's burning. An acute onset of shortness of breath can be a symptom of a heart attack. But here's the other thing. You just don't feel right. I just don't feel right. I know that there's something different. Then you need to go get that checked out. Okay, you with me? Okay.
Well, actually, I had two brothers died of.
All right.
Can nitroglycerin prevent heart attack?
Nitroglycerin is a medication that is used to help prevent a heart attack. It is a pill that you take to help the arteries open up so that you can get more blood to the heart. So yeah, if you start having angina, that kind of pain, you can take a nitroglycerin. All right? But since you brought that up, since you brought nitroglycerin up, let me tell you something. You cannot take nitroglycerin and Viagra at the same time. All right? I just need to make sure you understand that. All right? Because those two drugs do basically the same thing. Okay? If you take Viagra, Viagra opens up the blood flow going to your penis. All right? When you take nitroglycerin, it opens up the bloodstream going to your heart. You take two of those things together, and that's why they tell you you can't take Viagra and a nitroglycerin together. You'll be coming and going at the same time. All right. Yes, sir.
Just one other thing you didn't hit on, and if you don't mind speaking about it, is that cholesterol medicine.
Yes,
and the heart.
I should have hit on that because that is a risk factor. Cholesterol medicines are used to decrease the buildup over time that's in the arteries, okay? Cholesterol medicines usually don't have any side effects. Notice that I said usually it can. And it's probably a medication that's given, it's the most common medication that's given by prescription that's not taken by patients. And the reason why is because patients don't understand that it's not going to make you feel better. And you're not going to notice any difference if you don't take it. But I'll give you a story that that happened to me. I had a patient, he was about 35 years old, and he had already began to have some problems getting an erection. And so he came to me to find out what we could do about it. And so we just did a series of tests on him, and we found out that his cholesterol was sky high. That's all that he had wrong with it. His cholesterol was sky high. So I gave him the pills, and it's called a statin drug. Simvastatin, Crestor, Pravastatin, there are about a dozen of them. And in about 2 weeks, in about 2 months, he came back and he was feeling a lot better. But he also told me, he said, but I noticed that my erections are better. So now, why do you think? What's the relationship between the elevated cholesterol and the erection? Can you figure that out? Blood flow. So I noticed that he started running out of his cholesterol medicines early. Oh, anyway, I don't have to worry about that brother taking his medication no more. Okay? All right, so let's go ahead. Let's go on now and talk. Oh, we got one other question over here.
I know you give us the symptoms for heart attack, but what are the symptoms for congestive heart failure?
Congestive heart failure, that's an excellent question. Well, number one, congestive heart failure has been in the news. Heart failure. Nancy Reagan died from heart failure just a couple of days ago. And you may have remembered, if you pay attention to why people die, which I always do, Natalie Cole died from heart failure. Most people think that heart failure is just the heart stops working. That's not what heart failure is. Heart failure is when the heart cannot maintain the nutritional value of the body. Okay? In other words, if the heart is pumping, but the pumping in itself cannot pump blood to all of the necessary organs, that's referred to as heart failure. You can put yourself in a position like that if you have uncontrolled diabetes, That can contribute to heart failure. Uncontrolled blood pressure can contribute to heart failure. Being significantly overweight can contribute to heart failure. Lack of exercise can contribute to heart failure. It usually manifests itself by you can just be sitting right here in this chair, on this bench, and all of a sudden you just get short of breath. You just feel like something is on your back and you can't move. So that's what heart failure is. That's called congestive heart failure. It will also manifest itself by swelling in the extremities. The legs will begin to swell up. The feet will begin to swell up. You know, you get up to walk and you have to stop right here and settle down because your heart is not working efficiently enough to be able to cause the blood to circulate to take care of the needs of the body. So that's the difference. And heart failure is on the rise in African Americans, I might add. It's on the rise in African Americans. Okay? Thumbs up, are we good?